So today we're going to hear from our two postdoctoral fellows in Asia Health Policy. So I'll introduce them both, and then they'll each give a presentation. Since they're slightly different, although related, we'll have them present for 20-25 minutes and then have questions about their own presentation before the next one. So our first speaker is Dr. Mai Nguyen from Vietnam. She has a long history of working with the Ministry of Health in Vietnam and has graduate degrees from Boston from Brandeis and recently PhD from Australia Technology University. And she'll be sharing her research that she's been doing related to her responsibilities working in the ministry in Vietnam on what the public sector and the private sector do to support the population change in Vietnam, particularly the burden of chronic disease. And after Dr. Nguyen talks about her research, after Dr. Nguyen, then we'll be having our second postdoctoral fellow, Dr. Jinseok, and he's coming directly from finishing his degrees. He studied in London for his bachelor's and master's degree and his PhD at Seoul National University. And he'll be about technology and management, and he'll be sharing some of this research also related to demographic change. It'll be looking at age as one factor and looking at consumer choice of technologies such as electric vehicles. So please join me in welcoming Dr. Nguyen.
So today I'm gonna presenting my research on the factor affecting the use of private and public providers in diabetes patients in Vietnam. So this research is based on my previous research on the role of private healthcare in advancing universal health coverage in Vietnam. And in that study, I found that private sector improved access, enhance efficiency, and boost patient satisfaction. The study emphasized the value of integrating private care into broader health system to strengthen the health services delivery in Vietnam. So this study is my further work on the role of private health sectors by examining the factors that affect the choice among private provider and public provider in diabetes patients. So some basic information about Vietnam. Vietnam is situated in Southeast Asia. It is a member of Association of Southeast Asian Nations. The GDP growth rate hovers around 6% per year, and it is one of the fastest growing economy in Southeast Asia. Vietnam has a population of 100 million, with 12% of the population is now over 60. So the population is aging very fast. Vietnam aims to achieve universal health coverage by 2030, whereby all citizens can access to needed medical services and are financially protected against high healthcare costs. So how does Vietnam do so? Vietnam moved to HSC by implementing social health insurance. So this is a publicly funded body, and it is a single payer which is responsible for collecting premiums, purchasing, and paying for all its citizens' medical service and medical goods. And the rate of insured population significantly increased from around 43 to 90%, or 93% in 2023. Regarding the private health expenditure, so currently half of the healthcare expenditure is private health expenditures, and 40% of current health expenditures is out-of-pocket payment. So this is Vietnamese health system. This is a mixed health system of public and private providers, but public providers are dominant. So the public providers are distributed in 4 levels: commune level, district level, provincial level, and central level. So at commune level, this is the first point of contact when people seek medical help, and then based on their health condition and medical condition, people can be transferred to district and provincial level. At central level, there are some top national hospitals which take care of very complex condition and highly specialized care. However, you can see in yellow color. So the private health sector, in private health sector, there are only around 400 private hospitals. So the number is quite small compared to public one, but the number of private clinics is nearly 5 times the number of public clinics. So currently, public health system fail to meet own healthcare demands, so leading to some challenges in public health sector, such as overcrowding in public hospitals, long waiting time, complicated administration procedures, and lack of empathy from staff. There are corruption concern too, and shortage of high technology and modern equipment. So in this context, there's an opportunity for private healthcare to fill in this gap and to address the growing demand of care. So non-communicable disease and diabetes in Vietnam. So non-communicable disease is a really significant public health issue in Vietnam, as more than 80% of all deaths in Vietnam was from non-communicable disease. And diabetes is a second leading cause of the death from non-communicable disease. Currently, 7 million Vietnamese adults are living with diabetes, and prevalence has nearly tripled from 2002 to 2022. And more importantly, according to an estimate from the Ministry of Health, over 50% of diabetes cases remain undetected. So in the future, the demand for diabetic care is huge, putting significant pressure on the public health system. That's where private health providers come in. They increasingly play an important role to supplement the public sector to address this challenge in diabetes patients. So research objective. So there are 2 research objectives. First, to explore factors influencing diabetic patients' preference for public and private health providers in Vietnam. And second, to inform strategies that harness private sector while ensure equitable care access for diabetes. So we adopted discrete choice experiment design. This is a quantitative and survey-based method. It is well established in health economics for capturing trade-off that individuals make when selecting between alternative services. So this one survey is different from traditional surveys, that it gives respondents scenario to choose rather than ask direct questions. And we adopt this method to understand how diabetic patients choose between private and public provider, and to identify key service attributes that influence decision making in Vietnamese context. So there are 2 stages. The stage 1 is to develop a DCE tool reflect patients' priority. So we conducted interviews with health policymakers, health professionals from both public and private sector, and diabetes patients too. And the guiding question is, how do you or patients choose private over public services and vice versa? And the purpose of this stage is to identify and verify attributes and levels for the DCE and to ensure relevance to real-life care experiences in Vietnam, and to align survey design with local health realities. So the outcome of this stage, we identify 6 attributes that affect the choice between private and public services. First, appointment flexibility, Second, ability to choose a doctor. 3, quality of care and attention to diabetes-related concerns. 4, insurance coverage. 5, doctor's attitudes. And 6, number of prescribed medication. So this table illustrates the attributes and level. For example, the number 1, appointment times, there are 2 levels. So the appointment time can be made during or outside working hours, or only during busy hour. Choose the doctor seen. Yes means the patients can choose doctor for their treatment. No means doctor is assigned by the hospital and clinics. The quality of doctor examination, the level 1 is doctor examines the patient carefully, pay attention to diabetes-related problems such as insomnia, fatigue, anxiety. Second, the doctor only monitor blood sugar and adjust treatment. And then doctor attitude, drug choice, treatment cost. So there are 2 levels like insurance coverage or have to pay by pocket. So all those attributes and level we randomly combine to make choices. And this is an example of a choices. We make like a card to show to patient. So there are 2 scenarios to choose. First, the private clinic or hospital, or the second scenario is in public clinic or hospital, and with the combination of all level of attribute here. This is an example, and in total we have 16 choices. This is using efficiency function design. We have 16 choices, but because if you show all the choice cards to patients, all 16 process to patients at the same time, it will cause patient tiring, and it will give burden for the respondent. So we divided the choice set by 4. So we have 4 blocks. Each choice set will have 4 blocks, and each patient only answer 1 set of questions in this block. So meaning each patient only choose the 4 scenario. So it reduces the time on the effort of patients to answer, to choose the scenario. So the time conducted is between August to December 2024, and we have 194 adults diagnosed with diabetes in a provincial hospital in Vietnam. So the analysis used a mixed logic model. So this is key findings. So characteristic of the respondents. So the majority of respondents are older people as age over 61 and about, and women make up 60%. More than half the participants are retired, and a very high proportion are covered by health insurance. So still have nearly 15% of patients are not covered by any health insurance, have to pay by out-of-pocket payment. So our key findings. So what factors patients significantly value? So the most influential factors is insurance coverage. If insurance coverage is paid in for service in private providers, so the chance of patient choose this service win 3 times if it is paid in public one. The second factor is high quality examinations. So diabetes patients value comprehensive examination, meaning doctor pay attention to other personal issues like fatigue, insomnia, and anxiety, not just blood sugar level. And the possibility to choose doctor that you want to treat you, and the flexible appointment time. So those are 4 factors that patients significantly value. However, there are 2 factors that not significantly affecting choices. This is doctor attitude, interpersonal communication, the perceived attitude, and the number of prescribed drugs. So those 2 factors are not significantly affected the choice. So interpretation, our findings insight from diabetic patient, so that quality of services, health insurance coverage matter more than interpersonal factor in the care selection. And patients prioritize comprehensive management, personalized and affordable care. And private providers may be preferred due to the perceived responsive needs and access and the policy implication from this finding. So first of all, patient preferences are shaped by flexibility, quality, and financial protection. And harnessing private healthcare can reduce pressure on public system and improve diabetes management and care. And finally, this insight will support our ongoing research on the roles of private sector moving towards universal health coverage in Vietnam. So that's my presentation. Thank you for your attention.
All right, good afternoon, everybody. My name is Jinseok Kim. I'm a postdoctoral fellow at the Asia Health Policy Program and also a member of SNAPU. And so today I'll be presenting my working research. So any comments, feedbacks, or questions are welcome. Thank you, everybody, for coming in today. I see that a lot of you have finished your meals, so I'll try to finish fast and nice before the post-meal drowsiness kicks in. So the tentative title of my research is Future of Innovation Diffusion and Technology Consumption, Aging Creation. So as you can guess from the title, I'll be talking about how population aging will be affecting innovation diffusion and what this could mean for us. So just a brief background about the issue. In the frame in which I look into the issue, so amongst the Asian countries, I'm specifically looking into Korea, and it's not just because I'm Korean. And so here's why. Well, demographic changes such as aging population and increase in single-person household is a big trend amongst the world. Korea is actually one of the most, if not the most, rapidly aging country. And this is due to the sharp decrease in the total fertility rate, as well as noticeable increase in trend of single-person households. And another thing about Korea is that it's a very big test bed for innovative products with high internet speed and good infrastructure and consumer friendliness for new products. But this could change with population aging. So as you can see from this graph, by 2070, about half the population will be of age 65 and higher, which is really big. And this would have a huge influence to how a society adopts new technology. And so studying Korea will have big implications to the rest of the world regarding how these demographic changes can affect innovation diffusion and technology consumption, and what this means for the society, government, and for corporate management. So there's a lot of research going on regarding the effects and specifically the economic effects of population aging. For example, there's aging and economic growth, aging and labor market, and productivity. A lot of these researches have been going on in APARC by Karen. Specifically, I'm going to be looking at how aging affects innovation. So aging, population innovation, the topics could be divided largely into two: the demand for innovation and supply of innovation. I'll be looking into more of the demand side into the consumer perspectives. The diffusion of innovative technology may fail despite its clear technology advantages. For example, Google Glass or segways are big technologies that have pretty significant advantages compared to the existing technology, but these technologies have failed to diffuse in our society. And actually, potentially electric vehicle and fuel cell electric vehicles are also potentially new technologies that may fail to diffuse in society. And this is mainly due to the chasm that takes between, in the graph, early adopters and the early majority. So this is because the technology is mainly due to able to gain a larger acceptance from the public. Sorry about the mix-up, but I can still tell you the general trend. So age has been commonly identified as a demographic factor that affects user adoption and consumption of innovation. There has been some mixed results. Some of these results have shown that age has a negative effect, or some of them actually shows that there's no effect or even positive effect. This may depend on the innovation itself. But generally, it has been shown that age has a negative effect on new technology. And what this means is that Asian population may cause changes in established innovation diffusion patterns, and also increase the difficulty of overcoming the chasm. that harms the diffusion of innovation. So therefore, this is why it's important to predict and estimate the potential magnitudes and direction of this change and to prepare appropriate policies in advance, such as shaping up innovation pathway or government policy regarding maybe in my case, EV diffusion, electric vehicles, and corporate management and marketing. So there are two large questions that I try to answer in my research. The first question is using choice and preference analysis, like Mai, who used discrete choice experiments. So the first question is, does aging actually affect consumer preference, behavior, and choice? And if so, what does this mean in the future? And second analysis is the mediation analysis, which is looked into mediating factors of age. And actually, I also look into household size. And so how does these two factors affect and why affect consumer preference, behavior, and choice? So the first analysis, I'll be using data regarding consumer choice of electric vehicles. I'm specifically looking into consumer choice for electric vehicle in my research. The target is Korean consumers between the age of 20 to 60. I'm specifically targeting the population that emulates a sample that emulates the Korean population structure. So it has similar population distribution of age, gender, of income, whatnot. So this is to closely emulate the population structure of Korea so that my results can have more larger implications and echoing results. So the X-survey method, as I mentioned, is discrete choice experiments. So the methodology that I use is the mixed logic model, and I would bore you the details of this estimation method since I promised nice and easy presentation. So basically, I'm not going to bore you with the equations, but basically what the discrete choice experiment does is that it looks into a consumer's decision and looks into what factors influence these decisions. So I'm closely looking at the decision-making process of consumers. This is an example of discrete choice experiment. And so just to present my findings, the short answer is yes, aging actually does affect choice, and in a negative way. If you look at the results, on the left, those are the factors that influence the consumer's decision for choosing a vehicle type. The important factor that I looked into here is the fuel type. And using the interaction term methodology, factoring that into my model, and specifically into consumer choice for electric vehicle, I find that age actually has a negative effect on consumer preference for electric vehicles. But if you look at the numbers, preference for electric vehicle is actually positive, meaning that people tend to like electric vehicles, but with higher age, people tend to have a lower preference. So it means that age had a negative effect. So let's see how this translates into choice. So this graph actually, using the results from my first estimation, I have consumer preference structure for each respondent. And using this, I can hypothesize how this preference translates into their choice of vehicle type. From the model estimation, I get preference structure. And using this information, I forecast their indecision in certain scenarios. For example, I can see respondents' probability of choice for different fuel types. And if you look at the graph, the fuel types are gasoline, diesel, LPG, whatnot, that are commonly available in the market. So I constructed alternatives describing these different two fuel types with attribute levels that represent commonly average level of fuel type in 2025. For example, charging time for EV would be around 30 minutes, whereas gasoline would be like 5 minutes. So in addition, since I included age as an interaction term, I also have information to see how age affected each respondent's preference for electric vehicles. So using this info, I estimated how consumer choice probability fluctuated with change in average level population. And as you can see from the graph, with the increase in average age level, preference for electric vehicles actually declined, which shows that the negative lower preference for electric vehicles with age translated into lower probability. So we saw how age affected consumer preference and choice. What does this mean to policy, government, and corporate management? So for this, I'll give you some context into EV and Korean market and policy. So the market trends, as you see from the graph, it had a sharp increase in the beginning as attesting to my what I said about Korea as a testbed for new technology. But as you see in the recent years, in 2023 and 2024, there was a slowdown of sales because of rising prices and reduced subsidies. In terms of government policy, diffusion on EV is an important goal for the government policy for zero emissions and electrification of society. And it has a target of 4.2 million EVs on Korean roads by 2030. But actually, the government policy for subsidies on purchase for EVs has been reduced currently. So this is actually, it harmed the diffusion of EVA. And so factoring this into account to my previous scenario analysis, I saw combined policy context into the previous analysis and showed that using choice probability, I calculated the EV adoption volume by 2030 and seeing how many new EVs are bought each year. So in this 3D graph that you see on the here, the line describes how EV adoption volume fluctuates with changes in average age level and also the level of increase rate of subsidy. So the graph signifies several things. First, as you can see from the baseline of average age level and baseline of subsidy increase rate on the far right as signified by 1. First, the current subsidy rate is inadequate from the start, and the decrease in forecast is forecasted to push down total adoption volume further down. Increase in average age level of population will further harm the government's cause for EV diffusion, and this will be harming their goal and policy. And putting those two together, increase in average age level will require significantly larger subsidy for the government to achieve their goal and aiding in their EV adoption. So the red dots on the left here show the overall over the gray plane signify the levels of age level and subsidy where the goal is accomplished. The gray shade rectangle line is the 4.2 million goal for 2030 that I just talked about. So these red dots signify the levels of subsidy and average age level that is needed for the government to achieve this goal. And as you can see, a significant increase in subsidy is required, and also average age level will be significantly harming their cause for this EV adoption diffusion. So next, another interesting result is that household size also affected consumer preference for electric vehicles. As opposed to population aging, the increase in single household will actually have a positive effect to people's preference for electric vehicles. So this means that the increase in single household will negate the effects of population aging. And this is translated into choice. So you can see that the bottom line is the previous result from population aging. The top line shows the choice probability when factoring the increase in single households. So you can see that increase in single households actually negates the negative effect of population aging. So second analysis look into why and how the age and households affect people's choice for EVs. So this I do a structural equation modeling, and this estimates the mediating factors and analyze the relationship between an unadverse latent concepts. So in here, what I do is basically I analyze the direct and indirect effect of age and households on people's choice. So the variables I observe here are first observed variables are age, household size, and the choice probability that I estimated from my first analysis. And the latent variables or the mediating factors that I wanted to see are 11. So for example, perceived ease of use, perception of innovation, innovativeness. So these are commonly identified factors that affect people's choice of innovation in the previous studies. And these were measured by Likert scale questions in the survey. So this is a graph of how I analyzed SEM in my analysis. So you can look into age and households affect innovation choice probability, but also these other factors that I talked about, the latent constants, also have an indirect effect to the choice probability. So I see how the direct and indirect effect takes into play. And this is the findings that I have. So the factors in red box are the significant factors. So for a mediating factor to be significant, it has to have a significant relationship with both the age and households and also with innovation probability. And as you can see for age on the left, perceived ease of use had a significant relationship with both. With higher age, people tended to have lower perceived ease of use in electric vehicles, whereas higher perceived ease of use had a positive effect to innovation probability. So increase in average age level will actually harm the overall society's innovation choice probability. Increase in age has also increased effects on perceived risk, which has a negative effect on innovation probability. And higher age tends to have lower environmental awareness, which higher environmental awareness, whereas higher environmental awareness has a positive effect to choice probability. Actually, in households, it has similar mediating factors. It was 4. Perceived ease of use, perceived risk, environmental awareness, and what was different was fuel cost sensitivity. So as opposed to age, With single households, they have higher perceived ease of use, lower perceived risk, which all led to higher choice probability. They also had higher environmental awareness, and they were more sensitive to fuel costs. Since EVs have tended to have lower fuel costs, it led to higher choice of EVs. So using these results, I used the mediating factors to group the respondents into groups. And I did this using a K-means clustering method, and this is a machine learning method that groups data into clusters based on the similarity of the factors. So I identified 4 large groups. So the first group are young and single households with younger age, lower household size, and they had tended to have higher perceived ease of use, lower perceived risk, and higher environmental awareness. They tended to have higher fuel cost sensitivity compared to the population, which the average was around negative 0.2. So, and they tend to have higher EV prevalence, which all led to higher choice probability. Second group are young and dependent group who are younger than the population average, but then they tended to have higher household size, which means that they were dependent on their parents still. They have similar mediating factor average as compared to the first group, but they tended to have more sensitivity to fuel cost, which led to lower choice probability of EVs. And the third and fourth group are the more elderly population with higher age. And the third group are middle age with child, and they had a higher perceived risk, which led to lower EV choice probability. And the fourth, elderly population, they had lower perceived ease of use, higher perceived risk, lower environmental awareness, and which all led to lower choice probability. So to summarize, my research has 2 large implications. Implications to EV policy and implications to, in general, theories in innovation diffusion. So first for EV, higher subsidy are needed for as population society ages, and education and marketing to increase perceived ease of use, lower perceived risk, and increase in environmental awareness is needed for higher innovation diffusion of EVs. In terms of innovation diffusion theories, I identified age and household size as important factors in innovation diffusion, and also that they had opposite effects to their preference, people's preference for EVs specifically. Age tended to increase the chasm and make it more difficult for innovations to be diffused. So, and I also identified that these Asian households were more indirect effects as opposed to direct effects, which I identified in ACM. So mediating factors were more of the important factors that influenced innovation diffusion. So these factors were identified, and so these can be used to deal with innovation diffusion in the future. All right, and that will be it. Thank you.